Good morning. Today I'm talking about edema. I call it Happy Toe Tuesdays, and my name is Martha Hopflish. I'm a nurse that specializes on foot care. So I see edema a lot with clients, especially when they're a little bit older. It starts around your 50s where you stand a lot. If you stand a lot, the fluid in your body tends to settle in your legs, and if you have venous backflow where the flow doesn't get to your heart properly fast enough, you can get edema. And that what it means is that your skin gets distended because of all the fluid that's stuck in your limb. So this means that the circulation is affected and it's squished between the skin and the bone and the veins, because there's a lot of interstitial fluid. So the fluid is actually in between the cells and not in the veins as they are supposed to be. And then you get chronic venous insufficiency. I know my mother has this. She has very bad venous flow, and this means that the blood just sits and it struggles to get back home to your heart, and this leads to discoloration because the blood leaks, and the heme causes discoloration because the red becomes dark brown, blackish, and people say, oh, I washed it and I can't get it clean, and you won't get it clean because it's actually a tattoo you give yourself. It's discoloration under the skin. It looks dirty, but it's not dirty. It's just one of those things that you get from having chronic venous insufficiency. What you also will find is people with this condition will have ulcers because the skin is not healthy, and then it becomes ulcerated, and it's very difficult to heal because there's not good blood flow. Then you get lymphedema, which is caused by the lymph that's not draining properly, collecting all the garbage from your body back to your heart, and this causes lymphedema, and you'll find that the foot is swollen. And then you get lip edema, which is extra fat, and that means the leg is swollen but the foot is not affected. So the most important thing about edema is to know that it's usually a bit of a process to get rid of. There's no quick fixes. Best thing is to make sure that you get your rest in, breakfast, tea time, lunch, tea time, dinner, sleep, is to lift your legs so that it is horizontal. It's easier to pump blood when it's back and forth rather than up and down. If you get a chance to set your timer, or make sure you drink your tea with your legs in the air so that you can improve your circulation. Also to remember that your calf muscles are your biggest muscle besides your heart. So if you exercise them a bit by moving your feet, it will help a lot to improve your circulation. And the next thing would be is to make sure that you drink your medication. A lot of these patients have heart conditions. The heart is struggling to pump the blood. It pumps against pressure because the veins are constricted because of high blood pressure, and it's really struggling to do its work. So you often need medication to make sure that your body doesn't retain the fluid. So you'll have diuretics that gets rid of the extra fluid so that your heart doesn't have to pump that extra burden of fluid through your body. And then the next thing is, sometimes they don't give you medication. They give you medication and circulation stockings or compression stockings. Now, compression stockings are very special. They're made just for you. You cannot give it to somebody else. I know a patient that hands out of compression stockings because she doesn't like wearing them, but the thing is you can't do that because it's especially designed for you. They measure it to fit you specifically, and what it does, it prevents the fluid from sitting in your limb, so it has to be perfectly shaped. So in the beginning it's really tough to put them on, but once you get used to it, it's amazing because your body just loves having good circulation, good skin, and then the problem doesn't go away, but it is maintained better. And this makes it so great because your quality of life is better. And I always say, if you have heavy legs filled with fluid, it makes you a very big risk for falling. And it's very expensive to have a hip replacement because heavy legs will make you fall. You tend to drag your feet, especially at the end of a day, and then your risk of falling becomes higher because seniors don't want to use canes or anything like that. So there you go. It's important to make sure that you have good shoes that will not constrict you. I will even say have more than one pair of shoes, one for the morning, one for the evening, so that you can adapt to your foot shape during the day, because it becomes more swollen at the end of the day. Or even if you have pants, to make sure that it has elastics that you can adjust, to make sure that you can accommodate your body as it changes throughout the day. So that's it from me for edema. Remember to subscribe to my channel. This is Happy Toe Tuesdays, and my name is Martie Hauptfleisch. Leave me your comments and subscribe to my channel, and I'll hope to see you next time.